Remember to subscribe and don't forget to hit the bell icon to never miss an update from Tips for Daily Life.
Anemia is a common problem in children. About 20% of children in the US will be diagnosed with anemia at some point. A child who has anemia does not have enough red blood cells or hemoglobin. Hemoglobin is a type of protein that allows red blood cells to carry oxygen to other cells in the body. There are many types of anemia. Your child may have one of these. 1. Iron deficiency anemia. This is not enough iron in the blood. Iron is needed to form hemoglobin. This is the most common cause of anemia. 2. Megaloblastic anemia. This is when red blood cells are too large from a lack of folic acid or vitamin B12. One type of megaloblastic anemia is pernicious anemia. In this type, there is a problem absorbing vitamin B12. Important to making red blood cells. 3. Hemolytic anemia. This is when red blood cells are destroyed. There are many different causes, such as serious infections or certain medicines. Sickle cell anemia. This is a type of hemoglobinopathy, an inherited type of anemia with abnormally shaped red blood cells. Cooley's anemia, thalassemia. This is another inherited type of anemia with abnormal red blood cells. Aplastic anemia. This is failure of the bone marrow to make blood cells. What are the signs and symptoms of anemia? Some children with anemia don't have any symptoms. A child who does have symptoms might look pale, seem moody, be very tired, feel dizzy or lightheaded, have a fast heartbeat, have jaundice, yellow skin and eyes, an enlarged spleen, and dark tea-colored pee in hemolytic anemias. Young children with iron deficiency anemia also might have developmental delays and behavioral problems. How is anemia diagnosed in a child? Because anemia is common in children, doctors do routine screening for it. Plus, it often has no symptoms. Most anemia in children is diagnosed with these blood tests: hemoglobin and hematocrit. This is often the first screening test for anemia in children. It measures the amount of hemoglobin and red blood cells in the blood. Complete blood count, CBC. A complete blood count checks the red and white blood cells, blood clotting cells, platelets, and sometimes, young red blood cells, reticulocytes. It includes hemoglobin and hematocrit, and more details about the red blood cells. Peripheral smear. A small sample of blood is examined under a microscope to see if they look normal. To get a blood sample, a healthcare provider will insert a needle into a vein, usually in the child's arm or hand. A tourniquet may be wrapped around the child's arm to help the healthcare provider find a vein. Blood is drawn up into a syringe or a test tube. In some cases, blood can be taken using a needle prick. Blood tests may cause a little discomfort while the needle is inserted. It may cause some bruising or swelling. After the blood is removed, the healthcare provider will remove the tourniquet, put pressure on the area, and put on a bandage. Depending on the results of the blood tests, your child may also have a bone marrow aspiration, biopsy, or both. This is done by taking a small amount of bone marrow fluid, aspiration, or solid bone marrow tissue, core biopsy. The fluid or tissue is examined for the number, size, and maturity of blood cells or abnormal cells. What can I do to prevent anemia in my child? Some types of anemia are inherited and can't be prevented. Iron deficiency anemia, a common form of anemia, may be prevented by making sure your child gets enough iron in his or her diet. To do this, breastfeed your baby if possible. He or she will get enough iron from the breast milk. Give formula with iron. If your child is on formula, use formula with added iron. Don't give cow's milk until after age 1. Cow's milk does not have enough iron. It should not be given to babies until after 1 year of age, when he or she is eating enough other food. Feed your child iron-rich foods. When your child eats solid foods, choose foods that are good sources of iron. These include iron-enriched grains and cereals, egg yolks, red meats, potatoes, tomatoes, and raisins. Call your child's healthcare provider if you notice that your child has any of the symptoms of anemia. And if your child has not been checked for anemia, talk with the provider about your child's risk of getting it.
Thanks for watching. To get the latest videos related to health and medical topics, please subscribe to our channel. If you like this video, kindly share it with your friends and family. Do not forget to hit the like button. If you have any queries, please comment in the comment section.